Imagine waking up after a car accident and being told that you survived because someone that you never met before donated blood. Despite that person not knowing you, they saved your life. Therefore, I am for the donation of blood. As the Health University of Utah mentions, every 2 seconds, someone in the U.S. needs blood. As a current 6A whiskey in the Army National Guard and an EMT in Lacey, I've had to perform several blood transfusions on real patients. So why is this important? As the Health University of Utah mentions, additionally, trauma is a very common cause for the usage of blood, with trauma occurring at any stage of someone's life, even at birth. With, for example, newborn babies may need blood and require blood if they were born prematurely, or if trauma was experienced during labor and delivery. In this speech, I'll be talking about how the donation of blood saves individuals with cancer, how the donation of blood saves babies, and how the donation of blood saves your loved ones. I believe that many people would donate blood if they understood how urgent the need for it truly is. And as I relayed earlier, every 2 seconds, someone in the U.S. needs blood. Beginning with how the donation of blood saves individuals with cancer. As quoted, 25% of the U.S. blood supply is given to cancer patients only. When people with cancer don't get the blood products that they need, it can delay their treatment or cause them to feel very sick, as stated by the Mayo Cancer Center blog. Furthermore, individuals with cancer may need blood products due to significant blood loss that can occur due to internal bleeding, such as from colon or stomach cancer. Additionally, blood cancers such as leukemia and lymphoma can crowd the bone marrow with cancer cells, which leads to a decrease in blood production. With kidney cancer also changing the hormones in somebody, which also decreases blood production in someone. Moving to how the donation of blood saves babies. As quoted, very small premature infants are at a high risk for anemia and often need blood transfusions to survive, as stated by the Department of Pediatrics, Duke University School of Medicine. Furthermore, infants that are born prematurely are at a higher risk for anemia, which is too few blood cells in the body to transport oxygen due to the early stage of development. Furthermore, as well as infants that receive blood transfusions on time, they have a lower risk of death or developmental complications. Moving to how the donation of blood saves your loved ones. As stated, 8 out of 10 people need blood or blood products at some point in their lives, stated by the National Library of Medicine. Furthermore, 1 out of 10 people in a hospital setting require blood, with the average patient requiring 3 donations or 3 units of blood. However, patients in a hospital setting that have more traumatic injuries and require surgery as well may require many more donations. For example, a single car accident victim can require as many as 100 units or donations of blood. So I've talked to you about how the donation of blood saves individuals with cancer, how the donation of blood saves babies, and how the donation of blood saves your loved ones. I urge you all to search up a local blood bank near you and be the reason that somebody gets to live another day.